Question 1. What is the primary code book used for reporting physician and outpatient services and procedures? A. ICD-10-PCS. B. CPT. C. ICD-10-CM. D. DSM-5. Answer: B. CPT. This question is asking about the main code set for reporting services performed by doctors or in an outpatient setting, which is a fundamental concept in medical coding. The keyword physician and outpatient services and procedures is the key clue. The CPT, current procedural terminology, code set is specifically designed for this purpose, describing the vast majority of medical, surgical, and diagnostic services. ICD-10-CM is for diagnoses, ICD-10-PCS is for inpatient procedures, and DSM-5 is for mental health diagnoses. Remember, CPT codes describe what was done, while ICD-10-CM codes explain why it was done. Question 2. A patient presents to the emergency department with a severe headache. The physician performs a detailed history and examination, and medical decision-making is of moderate complexity. What level of E/M service would typically be assigned? A. 99,281. B. 99,283. C. 99,285. D. 99,284. Answer: D. 99284. This question tests your knowledge of evaluation and management, E/M, coding, specifically for emergency department visits, which is a common E/M category. The clues are emergency department, detailed history and examination, and medical decision-making is of moderate complexity. Emergency department E/M codes, 99,281 to 99,285, are often determined heavily by medical decision-making, MDM. Moderate complexity MDM, when combined with a detailed history and exam as described, typically supports a Level 4 E/M service, 99,284. A simple way to think of it is that higher levels generally involve more complex thought processes and risk from the physician. Question 3. In ICD-10-CM, what do the first three characters of a code typically represent? A. The etiology and anatomic site. B. The severity of the condition. C. The category of the diagnosis. D. Placeholder X. Answer: C. The category of the diagnosis. This question focuses on the structure of ICD-10-CM codes, a basic building block of diagnosis coding. The keyword here is first three characters in the context of ICD-10-CM. These initial characters form the category, which defines the basic condition or group of conditions. Subsequent characters add specificity regarding etiology, cause, anatomical site, severity, and other important clinical details. Think of the category as the broad topic, with later characters adding necessary details. Question 4. When coding a diagnosis documented as acute and chronic appendicitis, which should be coded according to ICD-10-CM guidelines? A. Only the acute appendicitis. B. Only the chronic appendicitis. C. Both acute and chronic appendicitis. D. Neither, requires clarification from the physician. Answer: C. Both acute and chronic appendicitis. This question assesses understanding of a key ICD-10-CM guideline regarding conditions documented as both acute and chronic. The phrase acute and chronic is the critical clue. The general rule in ICD-10-CM is that if a condition is described as both acute, sudden onset, short duration, and chronic, long duration, and separate codes exist for each, you should code both unless the index or tabular specifically instructs otherwise. This ensures the full scope of the patient's condition is captured. For example, coding both captures that the patient has an ongoing issue with a recent flare-up. Remember, when both are documented and codes exist, code both. Question 5. Which modifier is commonly used in CPT to indicate that a procedure was performed bilaterally? A. -25. B. -50. C. -51. D. -24. Answer: B. -50. This question tests your knowledge of common CPT modifiers, which provide additional information about a service or procedure. The keyword is bilaterally, meaning the procedure was performed on both sides of the body. The -50 modifier is specifically used to indicate that a bilateral procedure was performed during the same operative session. Modifier -25 indicates a separate E/M service on the same day as a procedure, -51 indicates multiple procedures, and -24 indicates an unrelated E/M service during a postoperative period. Using modifier -50 is crucial for correct billing when a service is done on both the left and right sides. Question 6. What is the term for the process of assigning numerical or alphanumeric codes to represent the diagnoses, procedures, services, and equipment described in a patient's health record? A. Auditing. B. Abstracting. C. Medical coding. D. Documentation. Answer: C. Medical coding. This question asks for the definition of the core task that medical coders perform. The description: assigning numerical or alphanumeric codes to represent diagnoses, procedures, services, and equipment is the direct definition of medical coding. Auditing is reviewing records for accuracy and compliance, abstracting is pulling information from the record, and documentation is the act of recording patient information. Medical coding is the process of translating the medical record into standard code sets for billing and data analysis. Question 7. In the CPT code book, where would you find codes for surgical procedures performed on the musculoskeletal system? A. Radiology section. B. Anesthesia section. C. Surgery section. D. Medicine section. Answer: C. Surgery section. This question tests your understanding of the main sections within the CPT codebook. The keyword surgical procedures and musculoskeletal system point towards where operative procedures are located. The CPT book is divided into main sections based on the type of service or body system. Surgical procedures, regardless of the body system, like musculoskeletal, are primarily found within the comprehensive surgery section of the CPT manual. Radiology covers imaging, anesthesia covers anesthetic services, and medicine covers various non-surgical procedures and services like immunizations or office visits. Question 8. What does the acronym HIPAA stand for in the context of healthcare? A. Health Insurance Portability and Accountability Act. B. Healthcare Information Privacy and Access Act. C. Hospital Information Protection and Administration Act. D. Health Industry Payment and Adjudication Act. Answer: A. Health Insurance Portability and Accountability Act. This question asks for the full name of HIPAA, a foundational piece of legislation in healthcare compliance that every coder must know. The acronym HIPAA is instantly recognizable in the medical field. It stands for the Health Insurance Portability and Accountability Act, passed in 1996. HIPAA is critical for coders because it includes rules regarding the privacy and security of patient health information, PHI, which we handle daily. Understanding HIPAA is essential for protecting patient data and maintaining compliance. Question 9. A patient is seen for a follow-up visit after a recent surgery. During the visit, the physician only addresses issues related to the recovery from the surgery. Which CPT modifier might be appropriate for the E/M service performed? A. -24. B. -25. C. -57. D. -79. Answer: A. -24. This question assesses your understanding of CPT modifiers used during a global surgical package period. The key clues are follow-up visit after a recent surgery and the physician only addresses issues related to the recovery. A global surgical package includes typical follow-up care. If an E/M visit occurs during this period but is unrelated to the surgery, modifier -24 is used. Since this visit is related to the surgery, it is typically considered part of the global package and might not be separately billable, but if it meets specific criteria for separate reporting, like a complication, -24 would indicate it was unrelated to the initial problem but related to the postoperative recovery, allowing for potential separate billing under specific payer rules or if it represents significant, separately identifiable work. However, among the choices, -24 is the modifier associated with unrelated E/M during a post-op period, making it the most relevant choice in the context of E/M during a follow-up phase, even if the visit's billability depends on specific circumstances beyond the question's scope. For a typical related follow-up, no E/M or modifier is usually billed. A great takeaway is that modifier -24 signals an E/M service during the post-op period that is not part of routine follow-up. Question 10. What coding system is used primarily for reporting durable medical equipment, prosthetics, orthotics, and supplies, DMEPOs, and other services not included in CPT? A. ICD-10-CM. B. CPT. C. HCPCS Level 2. D. ICD-10-PCS. Answer: C. HCPCS Level 2. This question asks about the code set used for items and services not covered by CPT, specifically mentioning DMEPOs. The key phrase, durable medical equipment, prosthetics, orthotics, and supplies and services not included in CPT points directly to HCPCS Level 2 codes. HCPCS, Healthcare Common Procedure Coding System, Level 2 codes, often called HCPCS, are maintained by CMS, Centers for Medicare and Medicaid Services, and cover a wide range of non-physician services, supplies, and equipment. CPT covers physician procedures, while ICD codes are for diagnoses and inpatient procedures. Remember, HCPCS Level 2 is for items and services not found in CPT. Question 11. According to CPT guidelines, what is required documentation for reporting moderate, conscious, sedation when performed by the same physician providing the diagnostic or therapeutic service? A. Only the physician's order for sedation. B. Physician monitoring is not required if a nurse monitors. C. Documentation of the physician's personal supervision and monitoring of the patient. D. Documentation by anesthesia staff only. Answer: C. Documentation of the physician's personal supervision and monitoring of the patient. This question tests a specific CPT guideline regarding moderate sedation coding. The key is same physician providing the diagnostic or therapeutic service and moderate, conscious, sedation. When the physician performing the main procedure also supervises and monitors the moderate sedation, specific CPT codes for moderate sedation can often be reported in addition to the primary procedure. A critical requirement for billing these sedation codes is the physician's direct personal supervision and monitoring of the patient throughout the sedation process, which must be clearly documented in the medical record. Ordering sedation isn't enough, and relying solely on nursing or anesthesia staff documentation doesn't meet the requirement for the physician's service. Documentation is always king in coding. Question 12. A patient undergoes an appendectomy, removal of the appendix. In medical terminology, what does the suffix ectomy mean? A. Surgical repair. B. Surgical removal. C. Visual examination. D. Creation of a new opening. Answer: B. Surgical removal. This question tests your basic medical terminology knowledge, specifically focusing on a common surgical suffix. The word appendectomy is provided as an example. The suffix ectomy consistently means surgical removal or excision. Understanding common suffixes like this is crucial for deciphering medical terms and correctly interpreting procedures documented in the health record. Surgical repair is plasty, visual examination is scopy, and creation of a new opening is ostomy. Learning common prefixes and suffixes will greatly help you understand medical reports. Question 13. In ICD-10-CM, what is the purpose of a placeholder character, typically an X? A. To indicate that the code is provisional. B. To provide for future code expansion. C. To fill empty characters when a code requires a seventh character but fewer than 6 characters precede it. D. To denote an external cause code. Answer: C. To fill empty characters when a code requires a seventh character but fewer than 6 characters precede it. This question probes a specific structural detail of ICD-10-CM codes. The keyword is placeholder character, typically an X dot. In ICD-10-CM, some codes require a seventh character for full specificity, like for injuries or external causes, but the code description itself might only be 4 or 5 characters long. The X is used to fill the empty character positions so that the seventh character is placed in the correct position. It doesn't mean the code is provisional. For future expansion, that's usually reserved codes, or solely for external causes, though external causes often use it. Remember that X is a seat filler, so the important seventh character sits in the right spot. Question 14. Which of the following is a key component used to determine the appropriate E/M code for many office visits, e.g., new patient, established patient? A. Number of diagnoses. B. Complexity of medical decision-making, MDM. C. Time spent with the patient, face-to-face or total. D. All of the above, depending on the specific E/M category and documentation. Answer: D. All of the above, depending on the specific E/M category and documentation. This question asks about the factors that determine E/M codes, a fundamental concept in E/M coding. The phrase key component used to determine the appropriate E/M code is central. For many E/M categories, particularly office visits, codes 99202 to 99215 since 2021, the code level is determined based on either the complexity of medical decision-making, MDM, or the total time spent with the patient on the date of service. For other E/M categories, like inpatient or emergency department visits before 2023 changes, the extent of history, examination, and MDM were all considered key components. Therefore, depending on the specific E/M category and the current guidelines, the number of diagnoses, MDM complexity, and time can all play a role. E/M coding rules can be complex, so always check the specific category guidelines. Question 15. A patient is diagnosed with type 2 diabetes mellitus with diabetic polyneuropathy. In ICD-10-CM, how is this typically coded? A. Code for type 2 diabetes only. B. Code for diabetic polyneuropathy only. C. A combination code exists that includes both the diabetes and the polyneuropathy. D. Code type 2 diabetes and then a separate code for polyneuropathy, non-diabetic. Answer: C. A combination code exists that includes both the diabetes and the polyneuropathy. This question tests your understanding of ICD-10-CM combination codes, particularly common with diabetes diagnoses. The terms type 2 diabetes mellitus with diabetic polyneuropathy indicate both conditions are present and the neuropathy is a complication of the diabetes. ICD-10-CM often provides combination codes for conditions that frequently occur together, especially when one condition causes the other, like diabetes with associated complications. You would look up diabetes, then look for subterms related to complications like polyneuropathy, leading you to a single code that represents both the diabetes and the related nerve damage. Using a combination code is usually the correct approach when available, as it accurately reflects the relationship between the conditions. Question 16. According to CPT conventions, what does a symbol of a circle with a line through it, prohibited, placed next to a code number signify? A. New code. B. Revised code. C. Modifier exempt code. D. Code is not to be used with modifier -51. Answer: D. Code is not to be used with modifier -51. This question asks about the meaning of a specific symbol used in the CPT codebook. CPT uses various symbols to provide important information about codes. The symbol of a circle with a slash through it, prohibited, specifically indicates that the code is modifier -51 exempt, meaning it should not be reported with the multiple procedures modifier -51. This symbol is important for accurate modifier application. A solid circle indicates a new code, a triangle indicates a revised code, and there isn't a standard symbol specifically for modifier exempt in general, only for -51 exemption. Pay attention to the symbols in your CPT book, they provide crucial coding instructions. Question 17. Which part of the CPT manual should be consulted to find codes for laboratory procedures, such as blood tests? A. Evaluation and Management section. B. Anesthesia section. C. Pathology and Laboratory section. D. Radiology section. Answer: C. Pathology and Laboratory section. This question asks about the location of specific types of procedures within the CPT book. The term laboratory procedures is the key clue. The CPT manual is organized by type of service, and all codes related to laboratory tests and pathology examinations are found within the Pathology and Laboratory section. E/M is for visits, anesthesia is for anesthetic services, and radiology is for imaging and related procedures. Knowing the layout of the CPT book helps you quickly locate the correct code section. Question 18. When coding for a condition documented as possible, probable, suspected, or rule out in an outpatient setting, how should the coder handle the diagnosis in ICD-10-CM? A. Code the condition as if it exists. B. Code the signs and symptoms. C. Query the physician for clarification. D. Use a special code for uncertain diagnosis. Answer: B. Code the signs and symptoms. This question tests a fundamental ICD-10-CM guideline specific to the outpatient coding setting. The keywords are possible, probable, suspected, or rule-out diagnosis in an outpatient setting. Unlike inpatient coding where you can often code a probable diagnosis, outpatient coding guidelines prohibit coding diagnoses documented as uncertain. Instead, you should code the signs, symptoms, or conditions that led the physician to suspect the possible diagnosis. This is a critical difference between inpatient and outpatient coding rules. Always remember, for outpatient encounters, code what is, not what might be, for uncertain diagnoses. Question 19. What is the primary purpose of the National Correct Coding Initiative, NCCI, edits? A. To determine the medical necessity of services. B. To promote correct coding and prevent inappropriate payment of Medicare Part B claims. C. To assign accurate ICD-10-CM diagnosis codes. D. To set the reimbursement rates for procedures. Answer: B. To promote correct coding and prevent inappropriate payment of Medicare Part B claims. This question asks about the function of NCCI edits, an important compliance tool for coders. NCCI edits, developed by CMS, are designed to promote correct coding practices and prevent improper payment of Medicare Part B claims by identifying codes that are not typically performed together, correct coding unless a modifier is appropriate, or are components of a more comprehensive procedure, mutually exclusive. While medical necessity is related to payment, NCCI specifically focuses on coding pair relationships. Assigning diagnosis codes is done using ICD-10-CM, and reimbursement rates are set by fee schedules. NCCI helps ensure you're not billing for services that shouldn't be billed together. Question 20. A patient receives an injection of a drug. Which code sets would you likely use to report this service? A. Only a CPT code for the injection administration. B. Only a HCPCS Level 2 code for the drug. C. Both a CPT code for the injection administration and a HCPCS Level 2 code for the drug. D. An ICD-10-CM code for the injection. Answer: C. Both a CPT code for the injection administration and a HCPCS Level 2 code for the drug. This question assesses how multiple code sets are used together for certain services. The scenario is an injection of a drug. Providing an injection involves both the service of administering the injection and the substance, drug, being injected. CPT codes are used to report the administration service, the work of giving the shot, while HCPCS Level 2 codes are used to report the specific drug or biological substance that was injected. ICD-10-CM is for the diagnosis explaining why the injection was given. Therefore, both a CPT code and a HCPCS Level 2 code are typically required to fully report the service and the substance. You need a CPT code for the doing and a HCPCS code for the stuff. Question 21. What is the anatomical term for the study of tissues? A. Cytology. B. Histology. C. Anatomy. D. Pathology. Answer: B. Histology. This question tests your knowledge of basic anatomical and biological terminology. The key phrase is study of tissues. Cytology is the study of cells, anatomy is the study of the structure of the body, and pathology is the study of diseases. Histology is the specific branch of anatomy dealing with the microscopic structure of tissues. Knowing these basic ology suffixes will help you understand medical reports. Question 22. According to CPT guidelines, how should you report an unlisted procedure code? A. Only use unlisted codes for rare procedures. B. Submit supporting documentation, e.g., operative report, with the claim. C. Code the closest related listed procedure instead. D. Unlisted codes are not valid for billing. Answer: B. Submit supporting documentation, e.g., operative report, with the claim. This question focuses on the proper use of CPT unlisted procedure codes. Unlisted codes are used when there isn't a specific CPT code that accurately describes the service or procedure performed. When reporting an unlisted code, CPT guidelines require that you submit supporting documentation, such as a detailed operative report or physician's notes, with the claim. This allows the payer to understand exactly what was performed and determine appropriate reimbursement. Using unlisted codes requires extra effort to justify the service. Question 23. Which ICD-10-CM chapter contains codes for neoplasms? A. Chapter 1, Certain Infectious and Parasitic Diseases. B. Chapter 2, Neoplasms. C. Chapter 13, Diseases of the Musculoskeletal System and Connective Tissue. D. Chapter 21, Factors Influencing Health Status and Contact with Health Services. Answer: B. Chapter 2, Neoplasms. This question asks about the organization of the ICD-10-CM tabular list. The question explicitly asks about the chapter containing neoplasms, which are tumors or growths, including cancers. The ICD-10-CM tabular list is organized into chapters based on body systems or types of conditions. Chapter 2 is specifically dedicated to neoplasms, C00D49. Knowing the general layout of the ICD-10-CM chapters helps you quickly navigate the code book to find the correct starting point for coding a diagnosis. Question 24. When a coder is unsure about the correct code to assign for a service or diagnosis based on the physician's documentation, what is the most appropriate action to take? A. Choose the code that provides the highest reimbursement. B. Guess the most likely code. C. Query the physician for clarification. D. Refer to online forums for coding advice. Answer: C. Query the physician for clarification. This question addresses a crucial ethical and compliance principle in medical coding: what to do when documentation is unclear or conflicting. The most appropriate action when documentation is insufficient to assign a specific code is to query the physician. This process involves asking clarifying questions to obtain the necessary information to assign the most accurate code. Guessing, choosing the highest reimbursement code, upcoding, or relying on unofficial sources are incorrect and potentially fraudulent practices. When in doubt, ask the provider. Question 25. In the context of medical billing, what does the term clean claim refer to? A. A claim submitted with a paper format. B. A claim that has been paid by the insurance company. C. A claim submitted without any errors or missing information, allowing it to be processed efficiently. D. A claim for a preventative service. Answer: C. A claim submitted without any errors or missing information, allowing it to be processed efficiently. This question tests a fundamental concept in medical billing, which is closely related to coding. A clean claim is a billing term for a claim submitted to an insurance payer that contains all the necessary information and is free of errors. Clean claims can be processed efficiently and paid in a timely manner. Claims with errors or missing information are often rejected or denied, requiring corrections and resubmission, which delays payment. Submitting clean claims is a primary goal of the billing process. A claim being clean is about its format and content upon submission, not whether its paper has been paid or is for a preventative service. Aim for clean claims every time to ensure smooth processing.